Okay, good evening to all of you. Some of the students are online. I think my voice is audible to you. So inform your colleague that we are going to start our today's discussion. Please inform your colleague to join the discussion. Okay, so my voice is clear and audible, and PowerPoint is also visible to all of you, I think. Okay, so inform your colleague to join. We have started our discussion. Last time we have discussed about a screening test, if you remember screening test. And now we are going to discuss about criteria for screening test. Criteria for screening test. I am waiting for your colleague to join. So you may be remembering about screening test. So we have discussed that there is difference between screening test and diagnostic test. So if you remember that the difference, please write down the points in chat box. What is difference between screening test and this diagnostic test? What is difference between screening test and diagnostic test? Write down the difference in chat box. What is the difference between screening test and diagnostic test? It is good evening, not good morning. So write down difference between screening test and diagnostic test, or just simply write down what is screening test, whatever you remember from your last class. What is screening test? Yes, Manish is replying. Screening test is done on healthy and not applied in applied in mass of people. Very good. Okay. Any other response? Kinjal is replying. Screening test is applied to group. Diagnostic test is applied to single patient. Very nice. Okay. So more and more students are joining. Please inform your colleague that our lecture has started to join our class. Screening test is less accurate than diagnostic test. Yes, diagnostic test is done on sick and applied to single patient. Screening test less accurate and diagnostic test more accurate. Yes, screening test is less accurate. Again, same answer. So you are remembering the things. Very nice. Yes. Only 13 students. Please inform your colleague to join. Please inform your colleague to join. Screening test is less expensive. Diagnostic test more expensive. Screening test less expensive. Diagnostic more expensive. Okay. Same answer. It looks that you have copy pasted somewhere from somewhere. No problem. Just we need to learn. Whatever the method of learning is there, we need to learn. Repeated learning will only, it will give you the capacity in this field. Again, same answer copy pasted. So let's begin. And first of all, I would like to congratulate all of you that you have worked very hard in distribution of the medicine, whatever the messages I was reading. So I think arsenic album, that is the medicine that you have distributed or something else. And you have been working very hard in your area to distribute it to the patient. Well, tell me about that medicine, arsenic album, or is that anything else? Again, one answer. In screening, not a basis for treatment, and diagnostic is used for treatment, basis of the treatment. Very nice. You all have distributed that medicine, arsenic album, or something else. Tell me about that. Whatever I know, arsenic alb 30 years. Whatever I know about that medicine, that it has the role of suppression of the cough. It suppresses cough. Is it also having a role in immunity? Do you believe that? Is it written anywhere in your textbook that it is also? What is the role of the drug according to your textbooks, according to your reference, not from your belief or not what have you heard? According to your textbooks, what is the role of arsenica alb? What is it? Where it is used for? In allopathy, this arsenica and these are called as poisons, but here in homeopathy, these are used as medicines. You may have having another medicine that is nux vomica. In our forensic medicine textbook, nux vomica is there in poisonous parts. So I am asking about your subject. Write down what is role of arsenica alb. I am waiting for your reply before starting our screening test. Somebody reply. 31 students are there. Please inform your colleague that our class has been started and your attendance is also being taken. I know that arsenic alb suppress cough. That is it true or not? I'm waiting for your reply about arsenic alb. Nobody is replying. Okay, let us start. So criteria for screening test. As you know that screening test, it is the search for unrecognized disease. Let me select the pointer. Highlighters. So screening is for unrecognized, search for the unrecognized disease. So best example in nowadays, it is screening for corona. That in airport now you have heard that domestic flights are going to begin. Lockdown is almost open. Lockdown 4.0 is in open mode almost. So at the public places, in even in bus also, screening for corona. How? That is by thermal gun. If anybody is having temperature more than 98 degree, what is above normal, more than 38 degree centigrade and 98 degree Fahrenheit, more than 98 degree Fahrenheit, so it will be maybe considered that patient may be having fever due to corona. We cannot be sure that it is corona, so screening test is less accurate. You have already replied that screening test is less accurate. So searching for unrecognized disease in healthy persons or detection by mean of rapidly applied test. This thermal gun, we are applying with thermal gun, so that is within fraction of seconds it is giving us the result. So in healthy person, this rapidly applied test is giving us the result by examination or other procedure in apparently healthy individuals. So again, you have to remember this definition of the screening test. It is search for unrecognized disease or defect by the mean of rapidly applied test. It can be test also, it can be examination also. So you are examining application of this thermal gun. Using this thermal gun is examination. It is not every time necessary that we have to use laboratory test. We can use physical examination method, we can use questionnaire, we can use history taking. History taking is also one of the part of the screening and other procedure in apparently healthy individuals. So that is definition of screening test. Let me see whether you have applied arsenica alb, camphora 30. Okay, nobody has written about arsenica alb. What is role of arsenica alb? Okay, tell me other time. So Historical background, it is not important to remember, but it is very interesting because we have seen this. One of the word here, it is written in history, MMR. That is 1 mmr. You already know. Do you know what is full form of MMR? MMR. Write down the full form of MMR. Apart from the full form which is written over here, what is full form of MMR? What full form do you know? Full form of MMR that you know. Write down here. What is full form of MMR? Write down in chat box. What is full form of MMR? Write down in chat box. Full form of MMR. Have you heard this word before or not? What is full form of MMR? Yes, mumps, measles, rubella. It is measles, mumps, rubella. Measles, mumps, rubella. Measles, mumps, rubella. Vaccine. That is vaccine. Measles, mumps, rubella. There is one another MMR. There are 3 or 4 MMRs. One is measles, mumps, rubella. Another MMR. Yes, maternal mortality rate. Maternal mortality rate. Okay. Actually, it is ratio. Maternal mortality ratio. And third MMR, do you know, apart from this one MMR, it is written in your, you can see in the slide, it is mass miniature radiography. Mass miniature radiography, that is also MMR. So that is third MMR. Remember this. So one is measles, mumps, rubella vaccine, maternal mortality ratio, then mass miniature radiography, and fourth MMR. You may have find about this MMR in all out or that whatever repellents are there over there. You may find that. So guess which is that MMR? In advertise of all out and good night, it is written extra MMR with extra MMR. So guess what is that MMR? What is that MMR? Similar to maternal mortality ratio. Is my voice clearly audible to all of you? What is that MMR? Is my voice clearly audible to all of you? Okay. So that MMR is mosquito mortality rate. Mosquito mortality rate. Okay. So there are 4 MMR. Again, I repeat. One is maternal mortality ratio. Second is measles, mumps, rubella. Then third one is this mass miniature radiography, and fourth is mosquito mortality rate. Remember this. Okay. So in history of this screening test, mass miniature radiography, it is, see, try to understand this word mass again. So in screening test is applied in mass. Miniature means small, very small. Miniature means very small. And radiography, that is X-ray. Radiography is X-ray. So in previously, mass miniature radiography was used for identification of the TB in mass. So at that time, screening test, idea of the screening test began. So that X-ray, we have seen that X-ray during our UG, that were very small, minute X-ray, mobile size X-ray. So this is mass miniature radiography. So after the end of the Second World War, when effective treatment for TB were introduced, MMR became the widespread in many Western countries. Even in India, MMR was, that is mass miniature radiography, was used. So that is a radiography in mass, which is using the screening test for TB. So gradually the concept of screening began to be considered equally applicable for the prevention of other diseases. So the history of the screening test started from the TB with the use of mass miniature radiography, and for other disease also this screening test the concept was widely applied later on. So concept of the screening in healthcare, that is actively seeking to identify a disease or pre-disease condition. So in mass, we want to identify the disease condition or pre-disease condition, pre-symptomatic condition. So early identification of the disease, it is possible with the help of the screening test. So in individual who are presumed and presume themselves to be healthy. So in case of the corona, we have the current example corona, that even asymptomatic or pre-symptomatic persons that are having also this corona disease. So in them, early identification can be possible with the help of this thermal gun. Nowadays, that RT-PCR is that it is the diagnostic test, but soon we will be having the ELISA test, rapid antibody ELISA test. Previously, that rapid antibody test was there, but it was not faulty test, so it was returned back. Now, ICMR has developed this ELISA test. It can be also used for this purpose. So it is used, if used wisely, it can be powerful tool in prevention of the disease. Screening can be the powerful tool in prevention of the disease if it is used wisely, and it is used in many other diseases also. For example, in NPCDCS program, or simply shortly we call as NCD program, each and every person which is about 30 years of age who is coming to PHC or CHC or any government OPD, they are being screened for hypertension with the help of sphygmomanometer. So as you know that in hypertension and in diabetes also, they are also being taken the blood sample for diabetes. In hypertension and diabetes, many a times there are no symptoms. Only we can identify with the help of the investigation like blood pressure measurement and RBS. So in these healthy persons, we are searching for hypertension and this diabetes. So it can be the powerful tool for early identification as well as prevention of the further complication of the hypertension and diabetes in this person. So it is essential to observe the long established principles and criteria and resist the introduction of the screening practices that do not meet this requirement. So there are some criteria. How should be the screening test? What are the criteria that we are going to discuss in this presentation? So criteria for screening test, these are based on two considerations. Remember in your exam also, if you are being asked screening test, there can be the full question of the screening test. So you have to write down this criteria. We are going to discuss some criteria. They are very easy to understand, very easy to remember. Or it can be asked separately also. That's criteria for screening test. It can be asked as a short note, criteria for screening test. So you have to remember this, whatever we are going to discuss now. So it is based on two consideration, the disease to be screened. So criteria are based on, first consideration is which disease to be screened, and the second is test to be applied. So disease and test. So disease to be screened and test to be applied. These are two consideration we have to take into mind while applying the screening test. Remember, these are not criteria, these are just consideration. Criteria we are going to discuss now. So the disease to be screened, the condition sort should be an important public health problem. It should be important public health problem. So again, I repeat that, no doubt, if you are asked the criteria for screening test, you have to describe both these considerations also, disease to be screened and test to be applied. So in which disease we have to apply this screening test? We cannot apply the screening test in each and every disease, for each and every disease. So that disease should be important public health problems such as hypertension, diabetes, tuberculosis. In tuberculosis also, we have to screen for more. If any person is having more than 15 days cough, we have to take the cough samples for sputum examination, because tuberculosis is important public health problem. In malaria, if any person is having fever, we have to take the blood sample for screening of the malaria, because malaria is also public health problem. So malaria, tuberculosis, in case of infectious disease, as well as in case of the non-communicable disease, hypertension, diabetes, these are important public health problem. That is our first thing in which screening test is to be applied. The condition or disease would have a recognizable latent or early symptomatic phase. If there is early symptomatic phase, and if there is latent phase period, so that we can have the time. Latent period means that it is the interval between onset of the disease to development of the symptom in case of this non-communicable disease. So if we have that time, we can prevent the early identification, prevent the disease with the help of the early identification. So it should have some early symptomatic stage. Natural history, including development from latent to declared disease, is adequately understood. The history, natural history of the disease, we have previously discussed about the natural history of the disease, that should be adequately understood. There should be a suitable diagnostic test that is available. After the screening test, we should have also some suitable diagnostic test that should be available, safe, and acceptable to the population concerned. For example, in case of the diabetes, RBS is screening test. It is not diagnostic test. If RBS is found to be more than 200, if it is found to be more than 200, then we can go for the diagnostic test, that is FBS and PP2BS. So after having the screening test, there should be, if some person is having the in screening test, that person is identified or suspected that person is suffering from the diabetes, then we should have the diagnostic or confirmatory test for that. If no confirmatory test or no diagnostic test available, then there is no role of screening test. Again, I repeat, so there are some consideration of the disease, that it should be an important public health problem like malaria, tuberculosis, diabetes, hypertension. It should have some early symptomatic stage. Natural history should be adequately understood. There should be a diagnostic test which is available, safe, and acceptable to the population concerned. Again, in disease, there should be an agreed policy based on a respectable test finding and national standard as whom to regard the patient, and whole process should be continuing one. I'm explaining this in simple term. For example, in case of the diabetes, there is national policy that if RBS is greater than 200, then we are going for the FBS and PP2BS. If FBS is greater than 126 and PP2BS is greater than 140, this is the acceptable policy, international acceptable policy. So there should be no ambiguity between different policies. There should be some acceptable agreed policy, at least for the nation, that whom to label as patient and whom to label as not having the disease, or I mean to say healthy person. Some of the person may be found in screening test as having the diabetes, but in confirmatory test there may be their levels are under the control, so they are not then labeled as patient. So there should be agreed policy, some criteria should be there, that whom to label as patient and whom to label as not having the disease. For example, in diabetes, I have already discussed. There should be accepted and established treatment or intervention for the individual. So after having screening test, after having diagnostic test, there should be treatment also available. And then there is only role of the screening test or diagnostic test. If there is no treatment available, then there is no role. For example, we are currently facing this treatment for this problem, that in corona there is no definitive treatment. Even though we are applying this test, that is to prevent the spread of the infection. Here our aim is, apart from the treatment, it is to prevent the spread of the infection, because it is rapidly spreading. So we are doing the testing. You know that in India today, more than 1 lakh tests every day, more than 1 lakh test, RT-PCR test for corona are being done. And till now, more than 25 lakh test has been done. From January, we had started doing testing in India from one laboratory to now 555 laboratories across country, and more than 25 lakh test has been done. And among them, you know that more than 1 lakh patient has been identified. So there should be some accepted and established treatment or intervention for the disease or pre-disease condition. The cost of case finding should be economically balanced in relation to the possible expenditure of medical care. So cost of case finding should be low. In case of the screening test, it should be low. Here in corona, we know that cost of one RT-PCR cost is 4,500 rupees. It is diagnostic test, it is not screening test, but just to add on this process. So that we have talked about this disease to be screened. Now about the test. So second consideration. First consideration we have finished. Now about second consideration, that is test. We are going to see about the test. So for the test must satisfy the criteria of simplicity, acceptability, repeatability, validity, and cost. We are going to discuss about this. So before that, write down that what you have remembered about discussion about the disease, for which type of the disease, or what are the consideration in disease. We have discussed about some consideration in the disease. What have you remembered? Write down in chat box. For which type of the disease, or what consideration in case of the disease we have to take while applying the screening test. What consideration about the disease we have to take while applying the screening test. Write down in chat box. Then we are going to see about the test. What consideration of the disease we have to take. डिसीज के बारे में हमको क्या कंसिडरेशन रखना चाहिए बिफोर अप्लाइंग द स्क्रीनिंग टेस्ट. What consideration we have to take about the disease before applying screening test. Write down in chat box. Whatever you have understood, write down in chat box. What consideration about the disease, or what are the criteria for the disease for which we have to apply the screening test. I'm waiting for your reply. What are the criteria we have to apply for the screening test? And considering the disease, what are the consideration of the disease? Yes, diagnostic test is important for the disease confirmation. Means you want to say that diagnostic test should be available. After we have passed through the screening test, there should be availability of the diagnostic test. Yes, very good, Hardik. Any other reply? Any other reply? See, this can be asked as a short note. I think again I have to discuss about that part. Yes, public health problem. So it should be, disease should be a public health problem. It should be having the latent stage. Policy to treat the patient. Natural history should be understood. Very good, Arpit. This is like for the disease like hypertension, it can be applied. Very good. Again, just I am going rapidly that we have seen that it should be important public health problem. It should have some early symptomatic stage. This public health problem, early symptomatic stage. Natural history should be adequately understood. After having gone through the screening test, the diagnostic test should be available. Then there should be some agreed policy, accepted and established intervention or treatment should be available, and cost of cash funding. It should be economically balanced. So these are some important consideration. Now we are going to see about the screening test, the criteria for the screening test itself: simplicity, acceptability, repeatability, validity, and cost. We are going to see one by one. So first about simplicity, name itself suggests simplicity. Screening test should be very simple. It should be very simple to perform. For example, applying the thermal gun for screening of the corona persons. So it is very simple test, right? We need not to have any laboratory equipment. For example, blood pressure measurement for screening of the hypertension. It is very simple test. Third example, RBS. If we want to measure the random blood sugar, it is also simple test for identification of the diabetes, suspected diabetes. So blood pressure measurement, applying thermal gun, is RBS measurement. These are very simple test and simple to interpret. It is easy to interpret. And where possible, capable of the use by paramedic. There is no need of the doctor in case of having the blood pressure for blood pressure measurement, for using this thermal gun. For RBS, there is no need of the doctor. Even lab technician, even non-medical person can also do this. You have seen that this thermal gun is used by each and every layman. If you want in your apartment also, your security guard may be using this thermal gun. for the entry of the persons who are entering in your apartment. So it should be used by any person. These are the example: blood and urine test, ECG. Even for ECG, for ECG taking, there is no need of doctor. For interpretation of the ECG, there is need of the doctor. Best example is this blood pressure measurement. Then second is acceptability. First was simplicity. Remember this: simplicity, then acceptability. Name itself suggests its meaning. Acceptability. It should be accepted. Since participation in single screening test is voluntary, the test must be acceptable to those undergoing. It may be involuntary also. In case of the corona, you have to everybody has to undergo this screening test. If you are going to the airport now, domestic flight will resume from 25th, so everybody has to undergo this screening test, even voluntary or not voluntary. In railways also, railway train has been started, so in railway also, before entering the train, the screening test is applied. So it is involuntary in case, even if you are not desiring, but you have to undergo this thermal screening. While in case of the OPD, if you are going to have the blood pressure measurement, it is voluntary. You can refuse, right? But it should be acceptable. The screening test should be acceptable. For example, blood pressure measurement is acceptable to everyone. Thermal gun, using thermal gun is acceptable to everyone. I'm giving you the example of the one of the non-acceptable test. For example, for screening of the prostate cancer, this digital examination through NS, for the palpation of the prostate, it may not be acceptable to everyone. So such test is not applied. Such test is not used as screening test, because through NS examination, for examination of the prostate through NS, it is not acceptable to community. So in general, tests that are painful, here this through NS examination, it can be painful, it can be discomforting, it can be embarrassing to the person. So it is not acceptable. So first criteria is simplicity, second is acceptability, then third is repeatability. The test should give consistent result in repeated trial. For example, you are measuring blood pressure of person 5 times. Some person 5 times. First time the reading was 160 and 90. So in second time it should be also nearby, plus or minus 5% blood, it should be nearby. For example, 158 and this 92. Third time it can be 155 or 156 and 88. So it should not be that first time 160 by 90 and second time 140 by 70. So variation, if wide variation are there on repeated measurement, it is not acceptable. It's this type of the test is not acceptable. So on repeated examination, for example, in case of the blood sugar, RBS, if you give 5 measurement, if first time it is 167, then second time it should be around 170, 175. It should be between 160 to 170. If wide variation are there, one time 167, another time 140, another time 200, then this is not acceptable. That repeatability is not falling. This criteria is not falling down. But this repeatability, it is influenced by 3 factors: observer variation, biological or subject variation, and errors relating to technical methods. So in repeatability, we are going that on repeatability there can be variation, and this variation can be of this type: observer variation, biological or subject variation, and errors relating to technical method. We are going to see one by one. So observer variation, there are 2 types of the observer variation: intra-observer variation and inter-observer variation. Remember, there is difference: intra-observer variation and inter-observer variation. Intra-observer, that is variation by single observer on the same subject at the same time. This can be minimized by taking average of the several readings. Suppose one observer is measuring blood pressure of the same person 3 times, then there can be some variation. Some degree of the variation. This variation, so average, we have to take the average. Suppose you are using the speed test by Ookla, or internet speed test, and you are using this speed test Ookla, and every time it is giving some variation. So you can take the average of your 3 or 5 observation, and then you can accurately say that this can be around this, right? So intra-observer variation can be minimized by taking the average of these 3 or 5 readings. Then inter-observer variation, Suppose one student is measuring the blood pressure of my blood pressure. One student is measuring the my blood pressure. Then after some time, another student is measuring my blood pressure. Then there can be variation between these two students, and there can be variation between two doctors. There can be variation in between two doctors in measuring the blood pressure of the same person. That is called inter-observer variation. Variation between two doctors, two investigators. Remember this, intra-observer and inter-observer. So variation between different observer on same subject, that is inter-observer variation. Reading of the blood pressure, X-ray. So this can be minimized by standard operating procedure, SOP. You may be hearing this word SOP now. In case of the corona, so all have understood these words: SOP, quarantine, isolation. These are the words of the medical things that have now widespread use. SOP, there are standard operating procedures. SOP guidelines are there. Intensive training of the observer. So training of the observer can minimize this variation. Making use of two or more observer. That average of that observer blood pressure can be taken. Second thing is biological variation. So biological variation is variation in ourselves. Suppose we take the blood pressure in morning, in afternoon, in evening, in night, then there can be variation in this blood pressure. It is not that our blood pressure is same at every point of the time. If we take our blood sugar in fasting, after taking immediately after taking meal, after 1.5 hours after meal, after 2 hours after the meal, so there can be variation. So this is biological variability, which is associated with the physiological variable like blood pressure, blood sugar, and this can be change in the parameter observed. Every time our parameters are changing in some range. Variation in the way patient perceive their symptom and answer. Someone may be perceiving the pain, even pain of small puncture. If there is variation between two male and female, so female may be perceiving the pain more than the male. So there can be variation between perception of the symptoms and answer. Regression to the mean, that is tendency for the value that extreme to the regress on repeated measurement. This is regression analysis. Actually, we will skip this. So biological variation, simply you can remember that there can be, this is because of the our biological physiology. That is because of the physiological changes, this variation can be within the person. Then error related to technical method, there can be errors in because of the defective instrument, because of the erroneous calibration, because of the faulty reagent. So if there is defect in instrument, if there is defect in reagent, if there is defect in blood pressure measurement instrument, and that is sphygmomanometer, then there can be also errors. So there can be variation. So in circumstance, the result of the single test may be unreliable. So we were talking about what? Third criteria, that is repeatability. Remember that previous criteria: simplicity, acceptability, that is then repeatability. In repeatability, we have seen observer variation, biological variation, and errors of the technical method. Then fourth is validity or accuracy. The test, again the word accuracy, must give the true measurement of the condition or the symptom under investigation. It should give the true results, accuracy, accurate results. That so glycosuria is useful screening test, and glucose tolerant test is more accurate. And glycosuria, it is useful. So glycosuria, that is passing of the glucose in urine. So passing of the glucose in urine, it can occur in case of the diabetes mellitus as well as in case of the diabetes insipidus. So to diagnose accurately, glucose tolerance test, GTT, it is the more accurate test. It is the more accurate test. Now, two important terms we are going to learn in case of the validity. It has two components: sensitivity and specificity. Sensitivity and specificity. Remember, this is now we are going to important part of the discussion: sensitivity and specificity. There is, it can be asked differently also in your exam as a short note. So there we have to learn about some two formula about sensitivity and specificity, and how to derive to the sensitivity and specificity of any test. So sensitivity, there is definition of sensitivity: ability of the test to identify, remember this very and pay attention over here, ability of the test to identify correctly all those who have the disease. That is called true positive. True positive. Pay attention over here and peacefully listen to this and try to understand this. Sensitivity is ability of the test to identify correctly all those who have the disease, that is true positive. So that is called sensitivity. So true positives. For example, in case of the 100 patients who are suffering from hypertension, 100 patients who are suffering from hypertension, if we apply this sphygmomanometer test, and this test gives in among 80% this correctly at correct identification, then this sensitivity is 80%. Then specificity, that is ability of the test to identify correctly all those who do not have the disease, that is true negative. So among 100 healthy person, how many healthy persons are identified that this disease, they are not suffering from the disease from the test, that is specificity. So sensitivity, two words you have to remember: true positive. Sensitivity is true positive, and specificity is true negative. So here the ability to identify the deceased person, here ability to identify the non-deceased person, we can say like that also. In sensitivity and specificity, you will later on understand with the help of the example also. So we have discussed about different criteria and sensitivity and specificity, and I am going to show you the formula of the sensitivity and specificity, then we will end to this session. So you can see that screening test result here, we have to first of all make this 2 by 2 table. Suppose screening test result, suppose for hypertension, we can say that positive and negative. Hypertension is there and hypertension is not there. So correctly, among diagnosis say that how many are disease and how many are not disease. So suppose one test say that the diseased person are 40 and non diseased person are 20, and that is said by screening test, that is 40 and 20 by this blood pressure measurement, and negative 100 and 98240. First of all, forget about this number, just remember that A, B, C and D. This is the unique method. You have to write down A and B in same line, and C and D in same line. You cannot write down your A and then you can write down A over here, then B here you cannot write down. You can have to write down B over here only. So total is here for positive A plus B, and for negative it is C plus D, and for all A plus B plus C plus D. So for the true positive, that is for sensitivity, that this formula is A upon A plus C. A upon A plus C. And I think that in your first instant you may not understand this, but on repeatedly, that is very simple actually. You can understand this. Sensitivity is A upon A plus C. So 40 upon 140 into 100, that is 28.5% sensitivity. True negativity, for the formula of the true negative or specificity, it is D upon B plus D. D upon B plus D. So into 100. So here 9840 divided by 9860 into 100. So that is 99%. 99%. So this is screening test. We have to write down over here positive, negative. Then what is actual diagnosis? Actual diagnosis. This is the result of the diagnostic test. This part shows the result of the diagnostic test. And this here we have to see that how many diagnosed as having the disease, positive has been identified and negative has been identified by screening test. We can discuss this repeatedly in our subsequent lecture also, so that you can understand it well, and I will give you the examples also. So remember this formula: sensitivity is A upon A plus C into 100, and specificity is D upon D plus D into 100. So what are the criteria for the screening test that you have understood? Write down in chat box, then we will end. Criteria for the screening test. We have discussed about different criteria for the screening test. What are the criteria for the screening test that you have learned just recently? Write down in chat box what are the criteria for the screening test that you have learned. Yes, very good. Simplicity. Then What about others? Okay, simplicity, acceptable, repeatability, simplicity, repeatability, yes, validity, very good. In validity also we have learned two things, two terms. In validity also we have learned two terms. So many students are replying, very good. In validity also we have learned two terms. Yes, one important thing, cost, very good. In validity we have learned two terms, sensitivity and specificity. Yes, okay. So we will continue with this screening test, and then we will start in a new topic also in next time. So we will end today. Thank you very much.